Hello, this is Katie Capps, Executive Director and co-founder of the Get the Medications Right Institute, and I'm here today with a member update on what we've been up to in September and October, as well as other exciting news and upcoming events for November. Now, with the July release of our Blueprint for Change, the Institute continues our call for medication management reform. Despite, or rather because of all the changes in healthcare this year as a result of the pandemic, we continue in our pursuit of getting the medications right the first time, which is more clearly needed perhaps now more than ever before. Now, as you may recall, the Blueprint for Change includes recommendations to engage everyone involved in patient care, from physicians to clinical pharmacists, health plan sponsors, providers, employers, consumer groups, and policymakers. Within the Blueprint for Change, GTMRX laid out 4 pillars of medication management reform, and those include revamping how we practice, how we pay, how we use diagnostics, and how we integrate technology. Since the report release, our work groups have been busy reviewing research, preparing guidance, and engaging other stakeholders in discussions around overcoming barriers to broad adoption and implementation of services designed to optimize medication use and deliver value to all stakeholders. I'll tell you a little bit more about that work later in the briefing. But speaking of value, as you probably know, earlier this year, we hosted our first public event with the Bipartisan Policy Center. Well, on October 9th, we held our second invitation-only executive roundtable, and joining us were members of the GTMRX board, the GTMRX executive members, work group leads, and VIP guests. The theme for the roundtable event was Paying for Value: Opportunities in the Medical Neighborhood to Get the Medications Right. The event was moderated by Susan Denzer, Duke Margolis Center for Health Policy, and it was attended virtually by close to 70 experts and thought leaders from across all sectors of healthcare. Featured speakers included Optum Care Solutions CEO Patrick Conway, Alade's VP of Clinical Strategy Annette DeBard, Cook County and Health and Hospital Systems Mark Loafman, University of North Carolina Eshelman School of Pharmacy Mary Roth McClurg, and Primary Care Collaborative CEO Ann Greiner. Now, at the beginning of the event, Paul Grundy, president of the Institute, kicked off the 4-hour event that focused on topics such as the importance of payment and policy change to achieve value, the way forward in practice transformation for pharmacists, physicians, and others on the team. We also talked about the impact of a crumbling primary care infrastructure and what we needed to do to help support and bolster primary care. We talked about the need for point of access to information enabled by health information technology and the value and importance of companion and complementary diagnostics. Over the coming weeks, we'll be releasing blogs, webinars, and material that was covered as part of the VIP invitation-only event. So as we continue our work around these 4 pillars of medication management reform, the Institute has scheduled, in addition to the executive roundtable that we hosted in October, a series of upcoming member feedback meetings. We'll be holding 4 events, and we need your input as a member of the Institute. It's vital. In addition to receiving your input, these events will showcase the work from our over 130 expert volunteers, and will also offer an overview of guidance documents that these work groups have been developing for advocacy, education, and to inform tools you can use to reform medication management. So join us if you've not already registered on November 12th. We'll be discussing how we use diagnostics. We'll talk about how we can leverage the power of pharmacogenomics testing to improve patient care. Then on November 13th, we'll talk about how we integrate technology using health information technology and turning data into actionable information. Then on November 17th, we'll be looking for feedback on how we demonstrate value for payment and policy reform to enable change. And then finally, on November 19th, we'll discuss how we practice with CMM adoption across the continuum of care. Now, these are membership feedback calls, and your voice is important. Your insight as a member of the Institute is invaluable to us. So please join us, offer feedback, and register today so we can continue to move forward to optimize medication use. You can register for those events on the GTMRX website. Now, as I previously mentioned, as part of our second executive roundtable, we had a number of national thought leaders join us. And we are currently in the process of releasing guidance and outputs from those discussions. Because this was an invitation-only event, we want to share some of the conversations held that day with you as a member of the Institute. Patrick Conway, CEO of Care Solutions at Optum, in a recent blog, discussed how changing how we pay for care leads to changes in how we practice. He also stressed the importance of an interprofessional team, including the patient. If you've not read that blog, please go to the GTMRX website and look it up. In addition to that, Mark Loafman, chair of the Family and Community Health at Cook County Health and Hospital System, addressed how we need CMM to optimize patient outcomes in the primary care setting. We've been doing it in other settings, but it's important to focus on how CMM can be leveraged at the primary care level in order to ensure patients are getting the right medication at the right time in the right way. Be sure to read these blogs if you haven't already to gain insight into their perspectives. You can find both of those on our website at www.gtmr.org. Now, in other news, there have recently been some changes to our board of directors with the addition of Dr. Anastasia Deifotis, who's representing board member J&J. Anastasia is the Chief Scientific Officer of Janssen North America and leads the Janssen Scientific Affairs Organization and the Janssen Medical and Scientific Affairs Council. As the leader of Janssen Scientific Affairs, she sets the company's medical strategy. She's responsible for accelerating the development of medical and scientific capabilities essential to winning in a value-based healthcare system. In addition to that, GTMRX board member Ira Klein deserves our congratulations as he's moved into a new role with Health New England, where he is now the Vice President and Chief Medical Officer. We are fortunate to have such stellar leadership guiding the Institute. And speaking of new leadership, several new organizations have joined the Institute as executive members and strategic partners. Executive members and strategic partners support the Institute through leadership and participation on our work groups, task forces, and learning networks. They support the work produced here at the Institute with their time and financial contributions. That helps us overcome barriers to achieving medication optimization. So thank you to all these organizations who play a huge part in leading the Institute in its mission and vision to get the medications right. Having dedicated members is crucial to our success. If you would like to further commit to the Institute through financial contributions as an executive member or strategic partner, please contact us. Now, another bit of news is what we're doing through the GTMRX Learning Network. We continue to provide informative webinars for our membership. On October 30th, over 600 people registered to participate in a webinar called Helping Employers Avoid Waste in Pharmacy Benefit Spend, the Role of Comprehensive Medication Management. Cheryl Larson, President and CEO of the Midwest Business Group on Health and member of the GTMRX Employer Toolkit Task Force, discussed how comprehensive medication management can strengthen employer health plans. Cheryl also, as I mentioned, is part of our Employer Toolkit Task Force, and she joins 9 other leading employer healthcare coalitions in the development of a tool designed to educate employers about comprehensive medication management, outline tools that will help them adopt these services, tools that will help them work with their medical carriers, and educate their employees. We believe this toolkit will be a powerful opportunity to advance and build demand for CMM services as employers, as plan sponsors, work with their health plans and PBMs to find innovative solutions. Be sure to keep an eye out for updates on the release of this toolkit. Now, if you're not available, or we're not available rather, for the live event on October 30th, the recording will be available soon on our website. So watch out for that, and watch out for the forthcoming issue brief as a result of that. I think it's important that you recognize that current models of paying for low-value medications no longer work, and employers are frustrated. And as health plan fiduciaries, they recognize that they can utilize today innovative strategies such as CMM to provide high-value care for plan participants while protecting plan assets. The webinar on October 30th outlined top employer health plan priorities for 2020. It offered insight into employer opinions concerning the current system of medication use. It also offered an overview of the CMM process for other employers. Cheryl discussed the strategies progressive employers are using to optimize medication use, as well as identified ways in which CMM can contribute to the accomplishment of employer health plan strategies. So as I mentioned, keep an eye out for the webinar recording as well as the forthcoming issue brief. Speaking of issue briefs, as you may recall, in September we hosted a webinar with Molly Ekstrand, Distinguished Fellow of the Get the Medications Right Institute, and GTMRX Strategic Partner from Teachers Retirement System in Kentucky, Jane Gilbert. The topic of the webinar was medication management reform, integrating technology to optimize medication use. The subsequent issue brief that was published after the webinar is also available on the GTMRX website. The issue brief covers how health information technology can be used to demonstrate the value of CMM through results. Only when we can show outcomes, economic, clinical, and humanistic, can we confidently support a scale-up and expansion of the practice. Again, visit our website to download not only a copy of this issue brief, but several other issue briefs as a result of educational opportunities. And with that, I'd like to thank you for listening to this update. Our sincerest gratitude goes out to all of our members, especially those who are on the front lines demonstrating bravery and commitment in the face of this challenging time. If you have any questions or would like to get involved with our work, please contact us. We would love to have more hands on deck, offering their unique perspectives to support our work. So until next time, be well.